Are you naturally flexible?
Or are you hypermobile? Or did you earn your flexibility through a series of intelligently designed strength-based flexibility techniques that you then dedicated decades of your blood, sweat, and tears to so that you could have healthy, pain-free, and sustainable flexibility that you could then show off on YouTube at the age of 41 because you did the right kind of training? That exercise, by the way, has nothing to do with anything. I was just doing that to try to keep your attention. In this video, I'm going to be covering the topic of hypermobility, what it is, and what other potential health problems can be associated with various syndromes and illnesses that are sometimes connected to hypermobility, as well as how hormonal health can greatly impact hypermobility and flexibility, pain levels, and joint stability, and finally, what we can do in terms of exercise and fitness, as well as some lifestyle and nutrition strategies that can improve overall hormonal balance, joint stability, health, and flexibility. Hi, I'm Ashley Lopez. I'm a professional dancer and contortion enthusiast who's been out about previously touring internationally, and I'm also a fitness, yoga, Pilates, and rehabilitative exercise instructor with over 2 decades of experience in the fitness industry. So hypermobility, what is it? It simply means that there's an excessive range of motion in one or more joints. Pretty simplistic, right? In clinical terms, each of our joints has a generally accepted normal range, and when a joint goes beyond that range, it's considered hypermobile, which is not in and of itself a problem. In fact, one's training, such as splits training or backbend training, can result in this excessive range of motion where it was not present previous to the training. How do you know if you're hypermobile? Well, you can have an expert look at you, and there are tests like the Beighton scoring system where you look at a few joints like fingers, knees, elbows, and see if they go beyond a certain range. And then you get some points, and then you'll be diagnosed as hypermobile or not. But basically, all of these tests are, in my opinion, overly simplistic because they don't look at all of the joints like shoulders or hips or sacroiliac joints. So while they can give you a tip of the iceberg idea, it's not a very good assessment, I don't think, due to their incompleteness. Now, this natural excessive flexibility is generally considered to be an inherited genetic trait, and it has to do with how the body produces various types of collagen. Collagen is the most abundant protein in the human body. It's important to note that not all hypermobile people have other health issues. However, some hypermobile individuals, especially those who have a more global hypermobility, like it's not just one joint, several of their joints throughout their body have hypermobility. They're likely producing collagens that are, to put it entirely too simply, not optimally formed, making it a syndrome. There are many syndromes that are associated with hypermobility, such as Ehlers-Danlos syndrome, Marfan syndrome, Stickler syndrome, osteogenesis imperfecta, and good old plain hypermobility spectrum disorder. And that's just to name a few. Individuals with these syndromes will have a variety of comorbidities or health issues that come along with their hypermobility. They may have skin issues, rashes, hives, excessively stretchy skin, they might bruise easily. They typically have joint issues, stiffness, and are prone to injuries such as dislocations, subluxations, sprains. They may just have generalized chronic pain. They may have gastrointestinal problems such as leaky gut, diarrhea, constipation. They may have autonomic nervous system dysregulation that may result in dizziness or fainting. And often because of all of these other health problems, they'll also suffer from anxiety, sleep disruptions, and other psychiatric complications. It's really not exactly fun or easy. Other things that can be extremely frustrating is that diagnostics for many of these syndromes seem to be in flux. In my research, I looked at several specialists who were talking about how they're struggling to understand these syndromes, and methods for diagnosis are still very much being explored and up for discussion. So sadly, suffice it to say, we're obviously still grappling to understand these illnesses, and that makes treatment very unclear and experimental and highly individual, as all of these things things exist on a spectrum and no two patients are alike. And of course, there are many medical and pharmaceutical interventions that one may want to consider if you have these syndromes, but that is not my wheelhouse, so I will leave that to the specialist to talk about. And add to all of this, hormonal fluctuations. Now, as it turns out, hypermobility is more prevalent in women than men, and women in particular have regular significant fluctuations in hormones. And these hormones do affect the bones, joints, and connective tissues. This can make the issue of flexibility, hypermobility, and joint stability quite complex. So let's break down a couple of these hormones. Estrogen plays a role in joint health. Low levels of estrogen can decrease the amount of synovial fluid in the joints, and that can contribute to the degradation of cartilage, resulting in painful joints that may also become inflamed. And that's observed pretty commonly in menopausal women. High levels of progesterone are associated with increased joint laxity, and progesterone levels fluctuate fairly dramatically during a regular menstrual cycle, meaning that at certain points when the progesterone is high, some hypermobile ladies may experience worsening symptoms and pain. Low testosterone levels can result in lower bone density and reduced muscle strength and size, resulting in overall physical weakness and greater risk to injury, not to mention joints that may be generally unhappy because your bones and your muscles are not strong. Relaxin is a hormone that increases dramatically in pregnancy in order to loosen up the joints to make way for a baby, but this can also contribute to joint instability and pain, especially around the pelvis, as well as overall greater risk to injury for pregnant women or women who are breastfeeding. And this is why it's crucial that pregnant and postpartum women follow certain modifications for training and intelligently train while pregnant. And please do train, ladies, when you are pregnant. Your health and the health of your baby and how well you are able to go through the process of giving birth are absolutely dependent on being physically fit. So what can we do? Guess what helps hormonal regulation? Exercise, physical activity, especially things like resistance training and sprint training. One of the most actionable things anyone can do when it comes to flexibility, joint stability, managing pain, or preventing injury is to train intelligently in such a way that you develop balanced strength and muscles that are not only strong, but long, so you have greater range of motion. No, it's not necessary to train extreme flexibility, but truly anyone can, and if done well, you can do so without causing chronic pain or injury. The trouble with hypermobile folks is that they really need to focus on joint stability and strength. They often need a little bit of help with learning how to exercise without injuring themselves. And this is going to require understanding good posture and alignment and technique, as well as how to increase strength in a way that promotes muscular balance. Enter strength-based flexibility training. Unfortunately, hypermobile people tend to be praised and exploited because of their natural excessive range of motion, and this will draw them to activities like gymnastics, dance, circus, martial arts, and the like, because they're good at it. But they can easily become injured or start experiencing high levels of chronic pain because those types of training aren't necessarily balanced in and of themselves. This is why I do what I do. I've researched and worked with some of the smartest people in the Pilates, yoga, dance, fitness, and flexibility realms, and I'm here to say that there are ways that you can train to reduce your pain and even fatigue and improve flexibility and joint stability. I offer a variety of courses on my website, ashleylopez.com, and there's everything from rehabilitative exercise, yoga, and Pilates to strength training and cardio to extreme flexibility and dance. Of course, I'm not the only one out there, so I'd urge anyone who is suffering from any of the things that I'm describing to find a great class, a well-trained coach, and start working on becoming stronger and more stable. There is no pill for getting fit. You just have to know how to do it without hurting yourself, and then put in the work. Now, exercise is essential. But there are other things that we can do to promote better overall hormonal health, general health, and psychological health. Learning to balance our schedules and reduce negative psychological stress is often essential, especially for anyone suffering from autonomic dysregulation. In addition to learning how to manage general stress levels, one can work on their personal relationships, on their sleep hygiene, and improve their sleep quality and circadian rhythms, practice behavioral therapy techniques or meditation techniques, brain retraining, breathing techniques, and so on. Mental fitness is essential to overall health, and just like physical fitness, we need to do exercises to keep our brains healthy so that we don't suffer from psychological stress. Health is not a given, and exercises are often a necessary intervention. And nutrition. Remember that what you consume builds your body. Amino acids are the building blocks of all tissues. So if you want healthy tissues, it stands to reason that you need to provide your body with high quality amino acids. I'm talking protein, people. And according to a mountain of modern evidence, I'm not talking about the RDA protein that was set decades ago based on much less evidence. We have a lot more now. Most protein experts recommend consuming about 1.6 to 2.2 grams of protein per kilogram of body weight per day. In the US, it's become kind of popular with many of these specialists to equate that to about 1 gram of protein per pound of ideal body weight, which might be overshooting it a bit for casual non-athlete individuals who are just looking to promote optimal health. But as I've seen in my practice with my clients and my students and my friends and family, if I give someone a slightly elevated goal, they might not make that goal, but they'll often come close, which is great. And remember that as we age, we're all losing muscle mass and bone density. And also as we age, we get worse at utilizing various nutrients. So we actually need more nutrient-dense food and not fluff. Not to mention, our appetites decrease as we age. So we had better make damn sure that the food that we're consuming is as high quality as possible. Speaking of quality nutrition, it's important to note that animal-based protein sources are the most bioavailable to the human body. In other words, the amino acids that you get from these is more efficiently absorbed and more easily used by our bodies to do things like building muscle and collagen and connective tissues, whereas plant-based proteins, they're just not as bioavailable. So if you're not consuming meat, eggs, and dairy, and you're relying on things like legumes, beans, nuts, and seeds, it might be wise to set your protein goal just a little bit higher to ensure that you're getting all of the amino acids that your body really needs to build those healthy collagens and tissues. High-quality healthy fats should be another consideration in nutrition for our joint and hormonal health, as dietary fat plays a crucial role in hormonal health. It serves as a building block for hormone production, particularly sex hormones such as estrogen, progesterone, and testosterone. And in fact, the marine sources of omega-3 fatty acids, EPA and DHA, play a big part in creating hormonal balance, primarily because of their anti-inflammatory properties. And lastly, don't forget about iodine, which is a mineral that is crucial for healthy thyroid function. Iodine deficiency can lead to a hormonal issue, as the thyroid can't produce enough hormones. And then there's the topic of inflammation. Many of these pain and joint issues are only going to be worsened with excessive inflammation. So to avoid that, we should also consider what foods might be inflammatory to the individual, as well as any toxins in the environment. Think about the water that you drink, and that may be coming with microplastics, nanoplastics, or heavy metals, as well as the air that you're breathing, and even the lotions, soaps, or clothes that you're putting on your skin. Really, perhaps we should be paying a little bit more attention to the products that we're using in terms of makeup and skin routines and hair routines and any of the stuff that you directly put on your body, because it's a highway into your system and you don't want toxic junk running around amok and contributing to things like endocrine disruption, inflammation, cancer, and the list goes on. So I hope that this video has given you a little deeper understanding of trained, healthy flexibility versus hypermobility, and maybe now you have some tools to help you develop strength and flexibility, whether you're hypermobile, hypomobile, or somewhere in the middle of the spectrum. As well, I hope I've given you some food for thought as to other nutritional, lifestyle, and psychological interventions that can improve hormonal health, circadian rhythms, and help you reduce overall overall inflammation, and therefore just really plain improve your health, whether you're suffering from one of these syndromes or just want to improve your health and resilience. Thank you so much for watching, and please consider subscribing. And if you do, I'll be putting out lots more great stuff on fitness, mental fitness, lifestyle, fertility, health, wellness, flexibility, dance, all the good stuff. And you never know, there might just be a cute and fuzzy creature to gaze upon as well. For now, be healthy, fight the good fight, pursue greatness, my friends, and I'll see you in the next one. Promote better all, better all. Okay. Ha. Blah, blah, blah.